Have you ever watched your dog growl at a stranger on the street, snap when someone reached over their head, or pull hard on the leash toward another dog, and immediately thought, my dog is aggressive? Hold on to that thought for just a moment, because today I'm going to challenge one of the most common and one of the most dangerous assumptions dog owners make. Hi, I'm Larissa. I'm a veterinarian, and today we need to talk about one of the most misunderstood topics in canine behavior: the difference between a dog that is truly aggressive and a dog that is terrified. These two things can look almost identical on the surface: the growling, the snapping, the lunging, but they are fundamentally different in origin, in what they communicate, and most importantly, in how they need to be addressed. Getting this wrong doesn't just fail to solve the problem, it can make everything significantly worse. So if you share your life with a dog, regardless of breed, age, or history, stay with me until the end of this video, because what I'm about to share could genuinely change the relationship you have with your animal. Let me start with a fact that most people don't realize. The vast majority of what we observe and label as aggressive in dogs is not rooted in dominance, territorial control, or malice. It is rooted in fear. This distinction is not semantic. It is the difference between mismanaging a problem and actually solving it. To understand why, I need to walk you through how a dog's behavioral and emotional system works. Dogs are social animals that evolved with a rich capacity for communication. Aggression, in its true sense, offensive aggression, is a tool that animals use to compete for resources, mates, or territory. But this form of aggression is far less common in companion dogs than popular culture suggests. What we see far more often is a behavior pattern that veterinary behaviorists classify as fear-based reactivity. Behavior that looks aggressive on the surface, but is driven by anxiety, threat perception, and a desperate attempt to create distance from something the dog finds genuinely frightening. Research supports this consistently. A landmark study by Duffy, Sue, and Serpell, published in Applied Animal Behavior Science in 2008, analyzed behavioral data across dozens of breeds and found that fear and anxiety were among the most significant predictors of stranger-directed and dog-directed aggression in companion dogs. This is not a fringe finding. It reflects a consensus that has built in the field of veterinary behavioral medicine over decades. Now, here is what makes this particularly difficult for owners to recognize. Fear in dogs does not always look like the trembling, hiding animal we might imagine. Fear activates the sympathetic nervous system, the fight or flight response, and when flight is blocked or perceived as impossible, fight becomes the next available strategy. A dog that has been cornered, repeatedly approached despite showing discomfort, or trained with aversive methods that suppress warning signals, may respond with what looks indistinguishable from aggressive intent. But it is not. It is survival behavior. Several factors increase the likelihood that a dog will develop fear-based reactivity. Inadequate socialization during the critical developmental window, generally recognized as the period between 3 and approximately 14 weeks of age, is one of the most significant. During this window, the brain is highly plastic, and experiences with different environments, people, and animals shape the dog's baseline emotional response to the world for the rest of its life. A puppy that misses this window without positive, varied exposure may develop a nervous system that is chronically primed for threat detection. Prior exposure to aversive training methods, a history of trauma or abuse, and certain heritable temperament tendencies also contribute. As Karen Overall emphasizes in her Manual of Clinical Behavioral Medicine for Dogs and Cats, behavioral problems, including fear-based reactivity, always reflect an interaction between genetics and environment, and never one alone. Now let me go deeper into what is actually happening inside your dog's body and brain during one of these episodes, because understanding the mechanism changes everything about how you respond in the moment. When your dog perceives a threat, whether it is a stranger reaching toward them, a dog approaching on leash, or a child running directly at them, the amygdala, which is the brain's fear processing center, activates almost instantaneously. This triggers a cascade through the hypothalamic pituitary adrenal axis, flooding the body with stress hormones, primarily epinephrine, also known as adrenaline, and cortisol. Heart rate increases, pupils dilate, muscles prime for action, and critically, the prefrontal cortex, the area responsible for calm, rational decision-making, becomes temporarily suppressed. In this state, the dog is not making a choice. The nervous system is responding to a perceived survival threat, and the animal has lost access to the cognitive flexibility that would allow it to respond differently. This is one of the reasons why the technical term for what we are discussing is fear-induced aggression, a label that immediately tells the clinician something important. The driver is not hostility, but threat perception. And it fits into a larger framework I want you to know about, the ladder of aggression, a model described by veterinary behaviorist Kendall Shepard in the BSAVA Manual of Canine and Feline Behavioral Medicine. This model describes how dogs communicate distress through a graduated sequence of signals that escalate in intensity only when earlier signals are ignored. A growl is not the beginning of the conversation. It is a step the dog has already climbed to after multiple earlier warnings went unheard. I also want to be clear that not every dog that growls or snaps has fear as the primary driver. There are genuine diagnostic differentials that must be considered. Pain-induced aggression is one of the most under-recognized. A dog with undiagnosed orthopedic pain, dental disease, or an ear infection may snap when touched in a way that has nothing to do with fear and everything to do with physical discomfort. Predatory behavior follows an entirely different neurological pathway and presents very differently. There is no threat display, no warning sequence, no escalation ladder. Territorial aggression and resource guarding also have their own distinct behavioral profiles. My point is this: I never arrive at a behavioral diagnosis based on a single observation. But fear-based reactivity is the most common explanation for what most owners describe, and recognizing it matters enormously for how we respond. So how do you actually read what your dog is communicating? This is what I want to give you now: the practical observational tools to see the signals before they reach the top of that ladder. The escalation of a fear-based response in dogs follows a recognizable progression, and each level gives you an opportunity to intervene. The first signals are the most subtle and the most commonly missed. Yawning out of context. When your dog yawns repeatedly during a social situation or low-level stressful encounter, not because they just woke up, is what behaviorists call a calming signal. Dogs use it to self-soothe and to communicate that they are not a threat. Many owners have never been told to look for this, and it passes completely unnoticed. Lip licking or tongue flicking is another early signal, a quick, almost imperceptible flick of the tongue over the nose in response to an approach, direct eye contact, or a perceived threat. It lasts less than a second in most cases. If you are not specifically watching for it, you will miss it every time. Whale eye is the term behavioral scientists use for when a dog turns their head slightly away from a stimulus but keeps their eyes locked on it, revealing a visible crescent of white sclera around the iris. It signals high vigilance and significant anxiety. Tucked tail combined with a lowered body posture and weight shifted backward is the body language of a dog trying to appear smaller, less conspicuous, less of a target. This is not shyness. This is active fear communication. Piloerection, the raising of the hackles along the spine, is an involuntary sympathetic nervous system response. Dogs do not choose to do this. It happens automatically under threat perception and signals a state of high neurological arousal. Freezing, when a dog suddenly becomes completely still, stiff, and stops moving, is frequently misread as the dog being calm or under control. It is neither. It is the moment of maximum internal conflict before a decision is made, and it often immediately precedes escalation. If your dog freezes, remove them from the situation. Do not wait to see what comes next. Growling is vocalized communication and is one of the most important signals on this entire ladder. A dog that growls is doing exactly what communication is designed to do, sending a clear message that it is uncomfortable and needs the situation to change. Punishing a growl teaches the dog to suppress the warning without removing the fear underneath, and the result is a dog that has learned to bite without any preceding signal. This is one of the most dangerous outcomes of punishment-based training, and it is completely preventable. Snapping in the air or making physical contact is the final step, the top of the ladder that the dog never wanted to reach. By the time most owners recognize that something has gone seriously wrong, the dog has already communicated discomfort 7 or 8 times in ways that went unseen or unheard. Together, this cluster of behaviors constitutes what the veterinary behavioral literature describes as fear-related aggression, and it is profoundly different from offensive or predatory behavior in terms of its neurology, its motivation, and how it must be managed. The work of Kendall Shepard in the BSAVA manual and Karen Overall in her behavioral medicine texts are consistent on this point. Understanding where on the ladder your dog is communicating tells you everything about how to respond. Now, recognizing these signals at home is valuable, but it is not the same as a clinical diagnosis, and I want to be very clear about that. The first step when you observe a pattern of fear-based reactivity in your dog is not to find a trainer. The first step is to see your veterinarian, and here is why. Medical causes must be systematically excluded before any behavioral intervention begins. Pain is one of the most underestimated contributors to reactive and aggressive behavior in dogs. A dog with undiagnosed hip dysplasia, an ear infection, dental disease, or early onset arthritis may snap or react in ways that are directly secondary to physical discomfort. Addressing the source of pain can change the behavioral picture dramatically, and without that step, no behavioral protocol will produce lasting results. Your veterinarian will conduct a thorough physical examination, including an orthopedic assessment, and will discuss whether blood work is indicated. One area I want to highlight specifically is thyroid function. There is published evidence indicating that hypothyroidism in dogs can directly contribute to behavioral changes, including increased irritability, aggression, and reactivity. Beaver's work in Canine Behavior, Insights and Answers discusses the relationship between endocrine dysregulation and behavioral presentation in detail. A thyroid panel is a relatively low-cost addition to routine blood work and can reveal a hormonal contributor that would otherwise go entirely undetected and untreated. After ruling out medical contributors, the appropriate next step, depending on the severity and pattern of behavior, is a referral to a board-certified veterinary behaviorist or a certified applied animal behaviorist. These are not interchangeable with general trainers, even experienced ones. A standardized behavioral history and assessment will characterize the behavior accurately, identifying triggers, threshold levels, and the specific diagnoses at play. For dogs with moderate to severe fear-based reactivity, the assessment will frequently lead to a combined recommendation of behavioral modification and pharmacological support. The American Veterinary Society of Animal Behavior, in their position statement on behavior modification, is explicit. Aversive methods, punishment, shock, choke chains, alpha rolls, are contraindicated and actively worsen fear-based behavior. Evidence-based practice centers on desensitization and counter-conditioning, implemented by a qualified professional, with medication when the baseline anxiety prevents learning from occurring at all. I am going to be honest with you about something important. There is no quick fix for fear-based reactivity. I say this not to discourage you, but because the false promise of a 2-week transformation is one of the most harmful things in the companion animal training industry, and it leads owners to give up on dogs that could genuinely improve with appropriate support. The process takes time. It requires consistency, professional guidance in most moderate to severe cases, and an understanding that what you are doing is not just training a behavior. You are helping your dog form new emotional associations with things that currently predict threat. The cornerstone of treatment is a behavioral protocol built around 2 evidence-based principles: desensitization and counter-conditioning. Desensitization means exposing the dog to the feared stimulus at an intensity well below the threshold that triggers a reaction, far enough away, quiet enough, slow enough, so that the dog remains in a regulated emotional state throughout. Counter-conditioning means pairing that sub-threshold exposure with something the dog genuinely values: high-value food, play, access to a favorite person. Over repeated and carefully controlled sessions, the emotional association begins to shift. What previously predicted threat now predicts reward. The neurological basis for this is well established. The brain forms new emotional associations through repeated positive experience, and those associations change the dog's automatic response to the stimulus over time. For dogs whose baseline anxiety is high enough that they cannot process any exposure without reacting, behavioral medication becomes essential, not optional. Medications such as fluoxetine, clomipramine, or situational anxiolytics are not sedatives, and they are not a crutch. They reduce the neurochemical noise enough that the dog can access learning. They make the behavioral protocol possible. The research supporting the combination of pharmacological and behavioral intervention in fear-based cases is well documented in the work of Landsberg, Hunthausen, and Ackerman in Behavior Problems of the Dog and Cat. Management is also a core pillar of treatment, not a sign of giving up. Preventing your dog from repeated above-threshold exposures, structuring the environment so that you control when and how your dog encounters triggers, is not avoidance. It is harm reduction. Every time a dog reacts, the fear pathway is reinforced. Every time you intervene early and allow the dog to experience the stimulus below threshold, you give the brain an opportunity to learn something different. Each case is individual, and that is precisely why ongoing veterinary and behavioral support is not negotiable when managing a dog with fear-based reactivity. Let me be honest about something before I give you these final recommendations. Not all fear-based reactivity can be prevented. There are genetic components to temperament and anxiety sensitivity that are outside anyone's control. And there are early life experiences that happen before a dog ever comes into your home. I will not promise you a checklist that guarantees your dog will never struggle with this. But there is a great deal that is within your control, and I want to close by focusing on that. The single most powerful preventive measure is appropriate socialization during the critical developmental window, between approximately 3 and 14 weeks of age. This means positive, varied, low-stress exposure to different people, surfaces, sounds, environments, and animals. Not flooding, not forced interaction, positive exposure at the puppy's pace. If you are considering bringing a puppy home, ask about the socialization practices of the breeder or rescue from the very beginning. Once your dog is home, never use punishment to address fear. This bears repeating because it runs counter to what many people have been taught. Punishing a fearful dog with physical corrections, loud voices, or intimidation does not teach the dog to be less afraid. It teaches the dog that when they are already afraid, bad things also happen. It escalates the fear and destroys the trust that any behavioral intervention depends on. The study by Heron, Schofer, and Reisner, published in 2009 in Applied Animal Behavior Science, is unambiguous on this point. Confrontational training methods provoke aggressive responses and produce worse behavioral outcomes than non-confrontational alternatives. Give your dog a safe space at home, a crate with comfortable bedding, a quiet room, a covered den, somewhere they can go and not be disturbed by other animals, children, or visitors. Respect that space unconditionally. Build predictable daily routines because predictability reduces ambient anxiety significantly. And do not force greetings. If your dog moves away from a person or another animal, that movement is communication. Honor it. And finally, if you see any of the signals I described today, the yawning, the whale eye, the freezing, the growling, act early. The earlier the intervention, the better the outcome. Call your veterinarian. Do not wait for a bite. I know that watching this kind of video can bring up difficult feelings. Some of you may be here because you had a scary moment with your dog, a growl that surprised you, a snap that left you shaken, or an incident that you are still processing. And some of you may be here because something in your dog's behavior has been worrying you for a while, and you have not known what to do about it. Both of those things are valid. The fact that you are here, asking questions and looking for real information, is already an act of love for your animal. The signals your dog has been sending, the lip licking, the freezing, the growling, were always communication. Now you know how to hear them. So here is what I want you to do. Schedule that veterinary appointment. Get the assessment done. Do not wait for the behavior to escalate before you act. And if this video helped you see your dog a little differently today, please share it with someone who needs it. Another dog owner, a family member, a friend whose dog the neighborhood is a little nervous around. It costs nothing to share, and it could make a real difference for a dog somewhere that deserves more understanding than it has been getting. Leave me a comment too. Has your dog ever shown any of these signals? Did something shift for you while watching this? I read every comment, and I love hearing your stories. Take care of your dog, give them a hug from me, and I will see you in the next video.